Hi.
Are you Brett?
Yes.
All right, I'm Julie. Nice to meet you.
Nice to meet you.
I'm going to be your nurse today, going over a few instructions with you, okay?
Okay.
So your doctor has prescribed you a beta blocker, correct?
Yes.
Perfect. Now he's asked me to make sure that you understand and know how to take your pulse, okay?
Okay.
So tell me a little bit about your current knowledge as far as taking your pulse goes.
I know how to do it, but I don't really know exactly what I'm looking for.
Okay.
Like what's normal or anything like that. And I've seen people do it on the wrist, but I've only ever taken it at my neck. That's the only place I'd seem to be able to find it.
Okay. And then tell me also, how do you best learn?
Usually just like with some instructions and just kind of verbally going over it.
Okay.
And then maybe just like a hands-on demo, one time or so.
Okay, so like written instructions,
Yep.
Explanation, and then a little hands-on.
Yep.
Okay, that's perfect. That's kind of what we usually do here. We have a little information pamphlet here on how to take your pulse. So we've created this for patients here in the office. Has a couple quick little important bullet points here in the boxes, as well as just a couple little pictures for you as well. Okay?
Okay.
Are you okay with me going over these instructions with you right now?
Sure.
Perfect. So the first boxes kind of talk about when to take your pulse. So you are taking your beta blocker daily, correct?
Yep.
Okay. So you want to count your pulse for a full minute, or you could do 30 seconds and multiply by 2. But really that full minute's going to be the most accurate.
Okay.
So you want to take it for a full minute before you take your beta blocker, okay?
Okay.
This is to make sure that your pulse isn't too slow. Beta blockers can slow down your heart rate a little too much, okay?
Okay.
That's just one of the common side effects, which I'm sure your doctor's kind of talked to you about a
Yep.
little bit, okay? The other thing about when to take your pulse, you don't want to... you want to have a good idea of what your resting heart rate is before you take your beta blocker. So if you have just gone for a jog, taking your pulse right after you've jogged is not going to be a good it's not going to be a good indicator of what your resting heart rate is. Okay. Does that make sense?
Yeah.
So we want a nice resting heart rate for your pulse before you take your beta blocker.
Okay.
And then the other time that you might want to take your pulse is if you feel like something is wrong. So if you feel like your heart's beating too fast, if you feel like it's irregular, if you feel like it's too slow, those might be other times that you want to check your pulse. Okay.
Okay.
Any questions on that?
Nope.
All right. The next bullet point we have here is what is considered a normal pulse. Okay. So normal pulse rate is anywhere from 60 to 100 beats per minute.
Okay.
And that's in a regular rhythm, okay? So you're kind of just looking for or feeling for something that's regular.
Okay.
If it's going like something like that, that's the irregular pulse, or that would be slow.
Okay.
That would be a rate under 60 beats per minute. Or if it's, going like that, that's probably going to be a little too fast, okay?
Okay.
So you're looking for 60 to 100 beats in 1 minute.
Okay.
The next part talks about what you will need to take your pulse, okay? So all you really need is a stopwatch or a clock. You can look on the wall. If you have a watch, if you have a phone, any way that you can just measure time, essentially.
Okay.
Do you have any way that you prefer? Watch, phone?
Usually have my phone on me, so I probably just use that.
Yeah. So what we'll do next is I'll demonstrate how to take your pulse.
Okay.
Here we've got a little picture of where you can find it, like you said, in your neck or in your wrist. And then we have, I put a little bullet point here saying press firmly enough to feel the pulsation but not too hard. If you press too hard, you probably won't be able to feel it that way. So maybe that might be a little bit of why you can't feel it in your wrist. Maybe you're not pressing down firmly enough.
Okay.
Let's check your wrist and see if we can find your pulse there. Okay, I feel it nice and strong there, okay? Let's see if you're able to find it.
Oh, okay. Yeah.
Yeah, and you feel that it's nice and strong, okay? That's another thing that we're looking for, you know, if it feels like really weak or if you're having to like really feel around and you're just hardly feeling like kind of, we call it thready pulse. That's another thing that you would want to report to your doctor, okay?
Okay.
So if you want to get your stopwatch ready, what we can do is I can feel your pulse on one wrist and you can feel on the other. We'll count for 1 full minute. Okay. And I just want to make sure that you're able to count correctly for that full minute to check your pulse rate, okay?
Okie doke.
So if you want to feel with your wrist, and I'll grab the other one and we'll see where we're at, okay?
Okay.
Tell me when you find it, okay? I'm going to straighten your wrist out a little bit here. Okay. Okay, what did you count?
Got 64.
All right, perfect. That is what I got.
Okay.
So how do you feel with that?
Felt pretty good. It was easier to find on my wrist than it was on my neck.
In your neck. Okay. Yeah, the wrist is a great place to feel the pulse for the most part.
Okay.
And you felt comfortable with the counting. One thing I find, I will glance at the clock, but sometimes it's hard to count and look at the exact numbers. Kind of get confused that way too. So, have it there within view and count however you're comfortable. Okay.
Okay.
The last thing that we will have you do is keep a little diary.
Okay.
So after you check your pulse, you want to just jot down what your pulse was. Your doctor likes to kind of check on that whenever he sees you for checkups, just to kind of see where you're at as far as your pulse rate goes, okay?
Okay.
So let's review a little bit. Tell me when you need to take your pulse and what is the normal pulse rate?
I need to take it daily.
Okay.
Before I take my beta blocker.
Okay.
When I've had at least 10 minutes of rest.
Okay.
I might also want to take it if I feel like something is wrong.
Okay.
Too fast, too slow, irregular, something like that.
Okay.
And then if I find the regular one, then I need to make sure it's within 60 to 100 beats per minute.
That's very good. Okay. And then you demonstrated how to take your pulse correctly, so that was very good. Is there anything I need to clarify for you, or do you have any other questions on maybe things that we didn't cover?
Not that I can think of, no.
Okay. Well, I will let you take your little information sheet home with you. It's just a nice little reference for you. And, our office phone number is on here too. So if you want to call us, if you think of anything, or of course, if you have any concerns, your doctor gave you parameters as to when to call or when he wants you to hold your beta blocker. And then, if you have any other questions at all.
Okay.
Okay.
Perfect. Thank you.
Anything else I can help you with?
No, I think I'm good.
All right. Thank you so much.
Thank you.
I hope you have a great day.
You too.